Good morning, everyone. Welcome back to day 2 of our conference. I'm Cassie Bruce, and I'm the chair of the First Coast Worksite Wellness Council, and we are so happy to have you at our 13th annual conference. We started out yesterday with a bang with Billy Blanks Jr. He was so inspiring, and he shared 6 steps for creating engagement at your workplace. So if you weren't able to attend yesterday, make sure you watch the recording that we'll send out next week. Today, we're going to follow up with another incredible speaker and national wellness expert, Jen Arnold. And before we jump into that, we're just going to do a few quick reminders on how to really maximize this platform that we're using, Remo. So you might have seen when you were in the ballroom view, there are 6 seats per table, and you can move tables by double-clicking the table that you'd like to sit at. If you have your video and microphone on, you're able to interact and live chat with the other people sitting at your table. If you look to the top right, you'll see your initials or your photo if you've updated your profile. You can update different areas of your profile and also connect to your social media channels like LinkedIn and Facebook. And as you may have noticed, when we're on stage like we are right now, your microphone and camera will be off, so we won't be able to see or hear you. However, we would love if you'd interact with us in the chat and the Q&A. If you have questions for the speaker, make sure to post them in the Q&A box. You can also upvote questions that have already been asked to move them to the top of the list. The chat box is used for just general chat, technical questions, and we have 3 types of chat. We have general chat where everyone can see, table chat where just the people at your table can see, and private chat where you can chat one-on-one with individual attendees. So let's warm up the chat box right now. As you all are about to learn, Jen is not only a wellness expert, but she is a road warrior and a travel expert as well. So in the chat box, if you would just put your favorite vacation spot or place to travel to. Costa Rica, Kalamazoo, Greece, Hawaii, the Keys, Italy, Disney World, Turks and Caicos. Oh, that's nice. Montana, Middleburg. There you go, right in our backyard. Zion National Park, Caribbean. I think we should all maybe just take a vacation right now, even though this conference is going to be great. Charleston, love it. Anywhere, yeah, I'm in the same boat. My bed, someone needs to go back to sleep. I feel that too. Vermont, I bet that's gorgeous. Lots of fun travel spots. Thanks for testing out the chat box with me today. Asheville, I just got back from there. Very cool. So now we'll do a quick video from our title sponsor, Florida Blue.
Hi, everyone. I'm Dr. Kelly Tice-Wells, Florida Blue's Senior Medical Director for Medical Affairs. I'm also the clinical lead for our COVID-19 response. Welcome to the 13th Annual First Coast Worksite Wellness Conference. We're excited to be a part of this ongoing effort to promote and improve wellness within our organizations. So much of our life is spent at work. Because of this, the workplace environment has a significant influence on health behaviors and outcomes for employees, particularly as we work to recover from the pandemic. As a health solutions organization, we're committed to helping our employer groups improve the health and well-being of their employees. Right now, the best way we can support our employees is to help them stay safe and healthy by advocating for vaccinations. At Florida Blue, we firmly believe that widespread COVID-19 vaccination is critical in helping us and our loved ones and our communities mitigate this virus and protect ourselves. It's a safe and fast way to get back to our lives and return to enjoying the moments that matter most. Thanks again for being a part of this event, and have a great day.
All right, thank you again to our title sponsor, Florida Blue. And now I would like to invite our events director, Elliot Asir, to the stage to introduce our speaker for today, Jen Arnold.
Thank you, Cassie, and welcome everybody. I hope you had a ball yesterday. We were talking at the table I was with a few minutes ago, and I think one of the things that was really neat about Billy's presentation was not just the dance, but it was his personal story, and that came across as really sincere and heartfelt. So that was neat. And you're going to get another great speaker now. Jen, as you may know, is the host of the Redesigning Wellness podcast, and if you haven't listened to it, you should definitely download it. There are more than 230 episodes on the topic of organizational health, and she's really been on a mission to change our common approach to employee health and wellness using training and speaking and honest conversations. I think you'll enjoy that. For the past, or for 16 years prior to starting her own business, she led organizational health and wellness efforts in several sectors. She was in community health, hospital systems, a health plan. She's been advising employers across a bunch of different industries on how to start and maintain effective wellness efforts. She's a TED Talk speaker and uses stories, activities, humor to not only make a point, but to keep audiences engaged and listening. And if you've listened to TED Talks, you know how important that is to them. And when Jen's not interviewing experts on organizational well-being and creating wellness incentives for employers, and I just lost my notes. Hold on. See, this is live. She's traveling around the U.S. in her RV. I was teasing her about this before, so how could I forget that part? So here's the tidbit about Jen that will ensure that you don't forget about her. April 2020 comes, last year. All of us hunker down. All of us think about what we can do to conservatively work through this pandemic that we didn't even understand. Jen says, I've got a great idea. I'm going to sell my house. I'm going to take an RV. I'm going to travel around the country. And that's exactly what they did. She sold her house in Raleigh and now lives in, as she says, a home on wheels with 2 kids, a 100-pound golden retriever. And we'll let you guess where she is as we go along. And then she'll tell you, I'm sure. So, when you think about this conference today and what Jen's going to talk about, as a society and as a wellness profession, we've been through an amazing amount in the last year, and you all should be congratulated for what you've accomplished. Just keeping your workforces together. If you think about it, a year ago, our schools were closed, our restaurants were closed, our gyms were closed, our beaches were closed. Everything was shut down. I live in Nocatee here, and last year at this time, you could see all the kids outside, parents trying to figure out how they were going to coordinate and get their own work done. And all of that had to be done on the fly. There was no manual. This was not like Y2K. We didn't have any user's manual to figure it out. So you all had to do that as you were going through the process and deal with all the anxiety, the burnout, the frustration, and keep your employees safe. And with a variety of different industries, and you can see from the names on here, and if you click on them and look at the different industries, we had essential industries who had marvelous years last year because they were producing critical products and services. We had industries that came to a grinding halt. So the question, quickly became, how do we survive this? And now, as we're reopening, the question becomes, what's well-being going to look like in what we hope will be a post-COVID environment, but maybe it'll be also a hybrid, a mixed COVID environment, maybe given what we're seeing from around the world. So with that, please give a warm welcome to Jen and listen carefully to her message. And as always, we will be following your thoughts in the chat room. So please add questions and thoughts and comments. And Jen, thank you for joining us today, and we're looking forward to hearing you.
Thank you, Elliot. I really appreciate it. And I feel like I need to defend myself a little bit. I feel like I've got some explaining to do. We actually sold our house before COVID hit, and then we quarantined for a while. But yes, we do live in an RV, and we are in Austin, Texas right now. So I hate that we're all not together in person, but I think one of the advantages of this virtual presentation is you can chat with me while I'm talking. Can't do that from a stage. So please use the chat. I'm going to encourage questions throughout. But shall we maybe go on a little bit of a backwards journey to what has happened? Many of you, about 14 months ago, were probably doing seminars and teaching events in person. And then now everything, just like it is today, is pretty much done remote. Or everyone was in their exercise classes. And then you're going, whoops, everyone, now we need to figure out how we get exercise classes is in your home, in our employees' homes. Or I've talked to several wellness professionals. I would love to hear your industry that are trying to help frontline workers, such as those in the healthcare realm, or had two different workforces, some that were kind of corporate white collar, able to work from home, and then some being essential workers, and there was conflict there. So you have been really dealt a wild hand. We all have, but specifically around well-being professionals, it's been kind of a roller coaster. So when we think about, if you can't even imagine back in the day what pre-COVID felt like, let me ask you this question. What is one thing you took for granted before COVID that you now appreciate? Put it in the chat for me, because I feel like there's some things that we kind of took for granted we didn't appreciate. Got 2 hugs, holiday gatherings, travel, for Vicky seeing people in person. Yeah, travel, separation for Katie, right? Because there's no separation at all. Hugs and toilet paper, gatherings, travel, hugs, social events, hopping on a plane, working from the office, Joni. So that's interesting. Birthday potlucks at work. Robert, that must have been a fun time at your work. Netflix, large gatherings, right? Breathing fresh air and freedom for Jen. So we had all of these things before, and we used to all gather together for social gatherings, be able to travel, have a lot more freedom than we do now. And it's kind of has been taken away from us. And what Elliot said is, what does that really mean for us as a well-being professional moving forward? And what do we need to consider? And that's really what I want to talk about today. Now, this was a Deloitte research. This is a Deloitte research that says 85% of organizations don't expect to really bring back the majority of the workforce until Q3 of this year. I'd love to hear who's already back in the office. I have a client who they really never left the office. They went home briefly and then they got back really early. I've heard Labor Day as being a marker for some, that they are going to say it's Labor Day, but they don't really know. So Lauren, you've been back for a while. But the way that organizations are looking at it, Paula's been back since May 2020, so really not left much. Okay, so for Denise, August 2nd, I'll return to the offices. And there are a subset of organizations that say, hey, we're never bringing everyone back. We're really going to embrace this remote working. And so that will look different for a quarter of the population. A lot of you have been back. So here's an interesting stat that there are some people who are hesitant of the future. This was an American Psychological study, an APA, American Psychological Association study that said 49% of people felt uneasy about getting back in person once the pandemic ends, which who knows? I've really stopped saying post-COVID and just said it's just the pandemic. I don't know if we're going to live in a post-COVID world. It may just be one of those things we exist with. Well, here is the kicker, that it doesn't matter if they received the vaccine or didn't, or not going to take the vaccine, it was the same. So almost 50% of people, even if they received the vaccine, were going to say, I'm still feeling uncertain about getting back in person. So Heather's saying you're retaining a hybrid model, so some may not come back. And then for Tracy's organization, that they actually have a choice, which is wonderful. So regardless of where you are with your organization, back at work or not back at work, or still kind of making that decision, anxiety is a real thing. I'm going to talk in depth about that. People are still working from home. If they are having to come back into the office, there's mixed feelings. Some, as you said, are like, I am ready to get back in the office. And some are like, I don't want to, and they may be forced to. And then there still becomes this uncertainty that we don't know what's going to happen when everyone's back in the office. And what I like to do is typically when something big happens to me, this is one of my resilience practices, and this could be something that you could label good or not good, like something big happens, I encourage people to usually find the learnings. And for our profession, I want you to really ask yourself these questions, and I'd love to hear your thoughts. What good can come out of this disruption known as COVID? And are there some opportunities that we can actually take advantage of as wellness professionals? Now, I've been talking about redesigning wellness for a while now. I left a corporate job. I've been in wellness for quite a while, well-being, whatever you want to call it. And I left my corporate job really starting to say, we need to do something different here. And, we talked about my 4 ways to redesign wellness were different pre-COVID, but now I almost feel like COVID has given us a wonderful opportunity to put well-being really at the forefront and think about how we redesign it and do it differently so our organizations and the employees in them can really take advantage of it. So I really think we need to not worry about the old stuff that maybe we were talking about. We don't need to go back to that world. I don't know if we can, but I want us to think about how can we put our energy into really building this new, what well-being can look like in our organizations. So I'm going to talk to you about 4 ways to redesign wellness. And some of these are not going to be anything that you probably haven't already thought of, but I just want, hopefully can put some fine points on them. The first one is the most obvious, and it is talking about mental health. Now, mental health was already making a little bit of headway in the well-being space and before COVID, but I feel like you can't not talk about mental health at this point. I'm going to read Tracy's comment real quick. This time has given lots of individuals the opportunity to reflect on what's important. So yeah, we took our physical health for granted, our safety of our physical health. And then of course, mental health is just the stats are overwhelming. And that's really what I want to go over with you all. Now, the APA, American Psychological Association, I'll just say APA from now on, so I don't butcher it, is calling kind of our mental health the second pandemic. And that even when we are physically okay, people are vaccinated, we're feeling like we can move about, that there's still going to be this mental threat there. And it's one that we cannot ignore. This is some research from the Kaiser Family Foundation. And what they did was look at January 2021 versus pre-pandemic, right? So pre-pandemic, the average percent of anxiety and or depressive disorder was 11%. You go to January 2021, almost a year after we were in it, 41%. I mean, that's a giant jump. Who's it affecting? Was definitely affecting the younger folks, whether they're in college or early entrance into the workforce. This is some of our workforce. And then secondly, ages 25 to 49. Who's it affecting the most? Well, women with children under the age of 18. Cassie and I were just talking about, yes, our kids are here, daycare shut down, and we're juggling a lot of things. And it's also impacting men. 40% of men are feeling the effect as well. And what they did too is look at the levels of stress, with 1 being the lowest and 10 being the highest. So think back into May or June of 2020. So in the pandemic, maybe 2 full months, the level of stress reported was 5.4. You go to August 2020, kind of in it a little bit more, 5. And then we go to January of 2021 and it goes back up to 5.6. And so we are now in May, and what I have been experiencing with the organizations I work with is a pandemic weariness, burnout. People are exhausted for putting their foot on the gas for literally 14 months. And the APA also found that people were experiencing some weight changes, and undesired, of course, 61%. And this was a sample of over 3,000 adults. 42% said that they gained more weight than they intended. And that the typical weight gain of this 42%, 15 pounds. Now going on, our sleep is impacted. 67% said their sleep was affected. Less sleep for 35% and 31% more sleep, which is an indication of potential depression and anxiety. You all are wellness professionals. You know the impact. If you're not getting enough sleep, your mental space it's unfocused and it's very cloudy. It impacts our work, our productivity, our emotions, everything. We're drinking a bit more. 23% are saying that that's how I cope. And that jumps up to 52% with people who have kids 5 to 7 years old. I'm just saying I have a 7-year-old. So I get it. I get it right there. We're delaying healthcare services. So one of the things that we do as preventive care measure, we talk about preventive care, right? We're trying to make sure people are getting the tests they need to get. But almost 50% said they just delayed it or they canceled it all together. Katie's clocking out with her wine, and Robert, I think, is having a drink right now. And so what we're dealing with, and what all of these indicators or outcomes are, what I call this kind of the iceberg, right? You're up here on this service, and we're looking at what we call outcomes. And so typically when we're seeing these type of outcomes, what do we like to do as wellness professionals? If you're seeing, I want you to put in the chat for me, if you're seeing people aren't getting enough sleep and they're gaining weight and drinking alcohol and they're not doing their preventive care, what is your natural inclination as an educated wellness professional? Any guesses? Any thoughts? All right. Okay, so yeah, Heather's saying that in the health risks, kind of the downstream impact of that, you're going, oh gosh, what do we do with the downstream impact? Well, I'll have to say, here's what I think. You may be tempted to address the outcomes. You may want to say, let me get people on a nutrition challenge, or let me do a sleep program, and nothing wrong with that. So I'm not saying there's anything wrong with that. Or you may be going, hey guys, you got to get on it. You need to go get your preventive care. Or you may be going, well, I don't know. This feels hard. I don't know what to do. I don't know what's really going on. I don't know if I can have that impact that I really need to have. And so, yes. So what Tracy's saying, employees are struggling to maintain those boundaries too. So they're overwhelmed and exhausted. So what I encourage you to do is to understand the root causes. And when you look down here, there's a whole part underneath the surface that is the rest of the iceberg. And I'm not saying you need to fix all the problems. I think you just need to understand that it's not as simple. And I know you understand this from you understand it. I'm not saying you don't, but just kind of taking that step back and saying, there's more going on. I can't just tell them to eat more fruits and vegetables. I need to think about other factors. And what gets to me, and this is not on you as a wellness professional, so I'm going to say that, in organizations, no one is talking about the work. And I'm saying from a leadership perspective, there's been no shifting of goals. There has been no lowering of expectations. In other words, business as usual and nothing as usual. So I'm not saying businesses have reacted. They've been doing everything they need to do to keep their employees physically safe. But I have not met one organization that said, oh, okay, well, I'm not going to give you that work and I am going to not give you that client because I know you're really busy and you're juggling all those kids that you got your homeschooling as well. Or you're so isolated and lonely that you don't even feel like working anyway. And this is one thing that we just have to be mindful of. I don't expect you to fix this, but it's just one of those things to understand. Here in my opinion, so please feel free to argue with me. Your role, our role as wellness professionals is to educate. Here's the deal. Here's what happens. Here's what's happening. Use those stats. Here's what's happening as a country. People are truly burned out. It is. Vicki was going, yes, we're all weary of it, right? And help your employers and your employees. So the stakeholders, the people making the decisions, help them and help the employees understand that, hey, you may be gaining weight because you are coping with food and you're not dealing with the anxiety. I get it. It's okay. But how can we get them to the resources? Because when we're eating things, oftentimes, if we're eating and we're not hungry, it's another thing, right? It's boredom, it's anxiety, it's those type things. Chances are you've got some benefits and resources, and I don't care how much you promote your resources, there's going to be one employee who says, I've never heard of that. So it's okay. Just keep promoting it. I work for a client who doesn't have an EAP. But thank God I've convinced them to bring on telemedicine and they can get counseling through telemedicine. I promoted the hell out of that. And that's all I had, but I kept promoting it. Providing space and reflection for your employees. And, when we think about this right now, some employees just want to be heard and they're not being heard. A wellness professional who has been in a training of mine said, they simply want the hospital administration to go to the floors and say, thank you for your work. That's what they want. And that hasn't happened. So sometimes you just need to provide that space to say, just let's talk. And I think you do need to get buy-in. I think you need to consider who you need to get buy-in from to make this happen, because not every organization is bought into promoting mental health. And Jen, you're right about empathy. I'm going to talk about empathy in a minute, but absolutely. Who do you need buy-in from? And you need to think about their belief system about mental health. Again, I'm going to keep going to this organization who didn't have an EAP because they thought you should address mental issues with their physician. So that's an existing belief system that I had to work with and around. What do they need? If you are dealing with a CFO, they may need financials. If you're dealing with more of a chief people officer, you may need more of a story or a mix of facts and stories. But you need to communicate to them in a way that they understand, not that you understand. Who do you need to partner with? We do not need to go at this alone. You may need to partner with a vendor. You may need to partner with your health plan. You may need to partner with your leadership and development team. Who knows? But you probably need to partner with someone to get more buy-in. I would love for you to put in the chat yes, no, or sometimes with, do you have buy-in to address mental health within your organization? So as I'm going through this, I'd love to hear about how you guys are doing within your organizations with your buy-in. Now, some other ideas. Cal says sometimes. It's true, right? Sometimes they are. Tammy, 100%. Carla says yes. I'm going to give you some ideas, but I'd love to hear more. Share mental health stats. I think that's the part that we need just to say that, hey, here's the reality. And I think that's telling employees that, hey, other people are going through this. You're not alone. There's a reason why you're kind of feeling foggy brained, and just let them know they're not alone. If you can get to claims cost and you can look at the behavioral health costs, the pharmacy cost, and sometimes, you know how some leadership can be very focused on the cost. So think about it from a claims cost perspective, see if you can get those numbers. Providing a feedback system for employees. So I was doing a resilience training recently, and I always provide a feedback loop for them. And several people said, this is great training, but what about the organization? What are they going to do? I was like, great point. Let me send this to the organization. And I said, hey, this needs to be addressed. Doesn't mean you have to do anything about it. Like, you don't have to have the solution, but you do need to maybe just give them a method of communication. And then sharing stories from employees is super helpful. Newsletter, you could do a podcast interview, but having that story come to life about how other people are juggling things as well. All right, a few more. I'm going to talk about managers in a minute, but managers being trained is vital. Promoting mental health screenings. There is a depression screening you can get hold of. And Mental Health America has a toolkit because May is mental health awareness. Encouraging small steps. Another training I did when we're talking about just taking a recovery break. Someone said to me, honestly, this feels like one more thing. I am so exhausted. This feels like too much. So when you are doing your health promotion activities, just the smallest step possible. That's all you want them to do. The other thing to consider is making employees aware that when we're stressed, our minds go very black and white. So what's happening right now from a workforce perspective, women are leaving the workforce. Women with children are saying, screw it, this is too hard. I'm going to go just focus on my kid and I'm leaving work. Whereas in organizations, oftentimes they will have a solution. Maybe it's a different role, maybe it's a part-time role, but there's usually something that can be worked out before someone leaves the workforce. So try to get your employees understanding that if you're in a negative thinking pattern, if this feels like too much, how can you get them to understand that you may be burnt out and stressed out? And you don't need to make a big decision right now. So Tracy, I love that you guys are having forums with your employees. I'd love to hear what's coming out of that. That's awesome. All right, so that's mental health. Now put in the chat for me. Hopefully you're still here with me. Are you addressing mental health in some form or fashion? Put it in the chat for me. Yes, no. Imagine everyone is. Okay, not enough. Okay. Everyone is addressing mental health. Okay, so except for not enough. Not as much as we would like. Okay, now as best we can. Do you feel like you can do more? Or do you feel like, I'm solid, Jen, we're doing it? Okay, so resilience, absolutely. Okay. I think you always can do more, but I also want to congratulate you all because the majority of people are going, Jen, I got this. I got this. But here's the thing. I don't want this to stop once we're back to what we say post-COVID, whenever that world happens. Please continue the focus on mental health. Oh, I love that, Sandra. Leadership culture to support mental well-being. Fantastic. And that is the second piece that I want you to consider is really thinking about your leadership and helping leaders, focusing on them, if you will. So put in the chat for me, how do you currently work with leaders in your organization? And it can be, I'm really thinking management, the middle people, the people who are really the bulk of your leadership. So I'm not worried about your senior execs right now. All right. Okay, so Tracy's done forums on parenting, racial injustice. Awesome. Mental health. Okay. Okay, good. Okay, so Katie's actually getting clients come to them to say, hey, our leaders need some help. Okay, promotion of resources, which is great because their managers are the first line of defense, Heather. So yes, they've got to know where your resources are. What about the rest of you? If you're checking your email, come back to me. Monthly resource emails. Okay, awesome. So some people are actually doing some specific mental health training for managers. Okay. If you're not working with your leaders right now, this is one that just, they are what I feel like are the key to wellness, really. If we're not working with them, then, I had a bunch of stats in here about how most people's bosses are the most stressful part of their day. We need to equip managers with the tools they need. Aaron, Brain Sharks, that brings me back to my Blue Cross days of Brain Sharks, toolkits. Okay, so you guys are doing awesome work. I wonder how many of you are actually managers, because I think before I was a manager, I'm not sure I understood that your role looked something like this. Like, it is a hard job. You're trying to please not only your people above you, but you're also trying to keep your team happy, which is always tough. I love this. You guys too, like, look at each other so you can look at these chats so you can connect with each other on what you're doing and then maybe connect there. I love mental health first aid. That's one thing that is a great tool. So for leaders, they have a very hard job, and I think they have had to go. So we've had leaders who have struggled as leaders, and then they've had to go to a virtual setting where if they're a micromanager, they're probably bugging the crap out of their employees, or if they're the opposite, their employees probably not hearing from them. And they're being put in that situation of managing a virtual team. Or what I've heard from a lot of managers is they are dealing with more personal issues that they've ever dealt with before. And that is really hard for them. So in the past year, what I feel like for leaders is they've gone from leading as normal, everyday leadership, to truly crisis leadership. It has been like this poor man or woman on the kayak trying not to fall down the waterfall. Like, it has been really hard for leaders. And when you're in crisis leadership, you can be a really strong leader, but oftentimes it's logistics, it's planning, it's keeping people safe. It is a really hard role. And so I feel like what organizations are looking for, this is from a Deloitte study, they are looking for, now that we are kind of coming out of the pandemic, emotional intelligence, inclusiveness, and social flexibility. So being flexible with how we get together in person. And what I have talked to leaders about is that you've been in crisis leadership, you've done a great job, you're probably burnout too. But when we think about what people need now, the workforce needs now in a continued uncertain environment with some mental health concerns, anxiety, remote work, we need to lead differently this year and beyond. And we've always needed to, let's be honest. But when you have a workforce that is struggling, then we need to really consider about how do you redefine the crucial leadership skills. And here are the three that I talk about to leaders, and they are emotional intelligence. And that is the ability to understand your own emotions and manage your own emotions, as well as read the emotions of people around you. So leaders with emotional intelligence are more likely to understand that their team is struggling or they're doing well. Resilience, we've always needed resilience, but God knows we haven't needed, I don't know if our resilience has truly been put to the test until this past year. But that's just the thing. It's going to continue to adapt and evolve. And I think this is maybe just the start of it. And the other thing that happens whenever we're in crisis leadership is we forget about the bigger picture or what's important to us. And this is what I talk to organizations. What are your values? You as a leader, you as a wellness professional, what are your values? Can you get reconnected to those? Or I should say, what is your organization's mission? And can you get back to that state with your people to say, here's why we do the work we do. Here's why it's important. Because when we're in crisis and we're thinking very small, we're thinking about us. We're not thinking about the organization, the bigger picture, the employees. And so it's very easy to get lost from that bigger picture. So talking to leaders about leadership skills. And for some of you, I'd be curious, are you already doing that? And some people feel kind of uncomfortable in this realm because if you have a leadership and development team, an L&D team or an OD, it can sometimes be a little like feeling like you're stepping on toes, but it doesn't have to be. I think at the very minimum, can you help leaders just help them identify how they react under stress? When you're a stress leader, how do you show up to your team and how does that impact them? Can you help them focus on their self-care? Because one of the things that when I talked to a recent group of leaders, and when I was talking to the people who hired me to bring me in, they said they will tell their team to take breaks and focus on self-care all day, but they won't do it themselves. And so we all know if a leader doesn't take a break, their team is less likely to take a break and focus on their own self-care. So try to help them understand that ripple effect. Oh, one thing that is so missed with leaders is connection activities. If you're still virtual, which many of you are straight up in person, but it doesn't matter, you need to connect regardless. Thinking about how can you arm them with some connection activities to use with their team, because they need that connection. People need that social connection right now, even if we are physically distanced. Tracy, you're having some great ideas and some great things going on in your organization, and I'm glad you're partnering in and outside of your organization for those. Educate them on the signs of burnout. Google it. You don't have to be an expert in burnout. Don't think you need to be. Care of themselves, understanding their stress responses, and those type things. And then also just keeping their eyes open for any issues on their with. Angela, you've traveled to Ireland, Morocco, and Paris with your team? That's virtually. I was like, what are you doing? And can I be part of your team? That would be awesome. All right, let's talk about diversity and inclusion. There's no secret what has happened this past year. A lot of political unrest has really come to the surface. And, you know, I'm not an expert in diversity and inclusion. Let me just say that right now. And every time I interview someone about DE&I, I feel like I'm putting my foot in my mouth half the time. But I think that we have to bring it up. I think we have to talk about it. I think me as a white woman needs to talk about it, because here you go. Here's me. Here's some colleagues and friends. You may recognize some of them. I don't know. But thank you, Tracy. I appreciate it. What? Everyone looks the same. I won't even ask you to tell me like what's missing here. We're all about the same age. We're all white. There's 2 males in here, which is always nice to have a little bit of diversity in it. But here's us, a bunch of peach crayons, creating wellness interventions, education and communication for a box of 64 colors of crayons. And there's nothing that, you know, when I look about it, so I'm going to tell myself here, right? I have a podcast and I've committed to say I need to get more diverse guests. And I have to actively go, how do I find more diverse guests? This is ridiculous, Jen. You have no expansion in your circle, and I need to do a better job. So I'm admitting that right now. But our field in health and wellness is a bunch of peach crayons. And I want more diversity in it. And how do we get that? But I want you to consider that even if you can't affect that, I think we need to think about what do we do with that with our employees? You've probably heard this. Okay. So diversity is being invited to the party. So you have that mix of the crayons, but inclusion is being asked to dance. And I think we have diverse people in our organizations mostly, but how do we bring and invite more people to dance with us. Because here's this. You can't have high well-being without inclusion. I think the two, you just can't. If people are not feeling included, if they are excluded, there's no way they can have high well-being. There's not a lot of research on this. There's one that I've actually seen, I almost put in here, but it was someone's study that showed that the more included people felt, the higher their well-being. But it's a no-brainer. So I don't think we need research here to say, think about a time where you weren't included. It doesn't feel good. And yet people in our organizations feel like that every single day. And so here are just questions. Some of you know me, some of you have never heard of me before, but one of the things I love to do is ask myself questions, because I think when we're asking certain questions, it can go, oh, okay, well, no, who's at the table making decisions? I'm going to give you another example. I was on a committee to help with a conference, and the conversation was about, we need to make sure we have diverse speakers, and we're talking about racial injustice, and we're talking about these things. And here's the thing, and here's how, I'm just going to say, white privilege showed up in my life. It wasn't until I walked away from it, I had some time to think about it and to say, we were a bunch of white people making those decisions. There wasn't one person of color. There wasn't one different religion. It was, again, a homogeneous group making these decisions. And so while there were great intentions, no one was setting out to hurt anyone. We weren't being inclusive. So who's at the table making decisions when you're talking about wellness and well-being? If you are creating standards or norms for wellness, that is already exclusive. That's standards. If you're saying that someone must be at this level, they have to look like this, and this is the ideal weight someone has to be at, or they have to be at a certain blood pressure, you're already being exclusive. And that's part of our industry, and that's part of the industry we need to continue to fight. When you're doing something, who is it easiest for? Is it easiest for your higher paid workers? Who is it hardest for? Who benefits the most or the least? Are there any cultural barriers? What data are you asking for? And I'm not saying I'm a data person. I like some data, but I know some organizations are very heavy into data. So just think about what are you even asking for in the first place? Is it relevant to what you need? Who's interpreting the data? So who are the people actually interpreting the data? Because as well as I do, we can all interpret data how we want to see it. I've seen enough presentations from people to say, here's the data and here's a white paper and everything looks really good. But they interpreted it in the way that would fit the story. And that's nothing new. That's just called marketing. How is the data interpreted? And I never thought of this question until I was doing some research on diversity and inclusion. And an organization said, we put out the results, and then we noticed that people of color interpreted the data differently than our white employees. So it's all of these things that it's just so easy to lose sight of when we're just making our decisions. So just a few considerations aside from those questions. If you have a DE&I, you don't need to say you need to become the diversity and inclusion expert, but you need to really be with them and say, how can I help you? They are linked. Well-being and diversity and inclusion are linked. When you're bringing in speakers and vendors, make sure you're not bringing in people that just look just like you, and it is the easiest thing to do. Believe me, I told you my podcast, I bring in people who look like me because that's who's in my circle. If you have an employee resource group, Tracy, you may have an employee resource group. But in my past organization, when I worked at Blue Cross of North Carolina, there was a whole group. There were some for young professionals, Black professionals, LGBTQ professionals. Lean on the employee resource groups as much as you can. When you have a committee, and how many of you have wellness committees? Diversity is the first step, but making sure that you're also getting inclusive opinions from everyone. At the bare minimum, let's use some diverse photos. Again, if you're doing a lot of education, just making sure that there is a mix up in the photos that are being used. All right, so I'm on to my fourth. And this is one of my, I've been talking about elevating the role of the wellness professional for a while, but now I feel like there's just such a great opportunity because well-being's at the spotlight and mental health is at the spotlight. And so how can we as wellness professionals say, hey, put me in, I'm ready. and how can we possibly elevate our role, because it is truly hard. So I want you to think about your workday, and I want you to chat into me. What do you spend your time doing at work? That's right, Tracy, now's our time. It absolutely can be our time. So put in the chat for me. Emails, Joan, seriously, the emails never stop. Okay, Tracy talks with employees. Engaging with members. Interviewing and hiring. Brainstorming, love that, Brittany. Emails and projects. so many emails, right? They never stop. Strategizing, love it, Ebony. Networking and planning. Email, okay, for Susan, sitting at your desk. Researching legislation. Communication strategy and outreach. Building partnerships. Okay, so you guys you're already doing some of this stuff. And so when I think of wellness professional, and there's different sets, like I was doing different things in my earlier days in career and wellness, as sometimes I'm doing now, but some of the same duties still fall on wellness professionals, even if in your 20th year. There's some things that employers expect. Planning, right? So you're planning. Tracy said you plan. We have to plan. You can't not plan. Coordinating events. How many of you are bringing in speakers? So you're coordinating that, making sure the Zoom link's set or people are there. You got the bio, all that stuff. The participation. How many people showed up? We need to make sure enough people show up. And then planning programs. So not just overall planning, but we're, kind of planning programs. And we may be messing with incentives. We may not. It just depends. We may be saying, hey, I'm the wellness police, and I need to make sure that you're doing what you should be doing. Or we are running exercise things or being told we should run exercise things. Or sometimes we are told to do way too much without the resources and without really the budget that we need, and a lot is expected of us. And so what I'd like to say is that when executives think of wellness in general, they can sometimes think that there's the business to be run. We got the business, the core business principles, and then we've got wellness. So wellness is like a tangential thing that if we cut it, it's fine. It's just diet and exercise. Now, I am not saying, so hear me this, I'm not saying you just do diet and exercise and that's all you do. But there have been many leaders that I've talked to. There have been many senior leaders and managers who think all wellness is a little diet and exercise. Yeah, financial wellness, thank goodness, is making its way into the wellness world. And when the leaders think that wellness is only diet and exercise, it's kind of like they're putting baby in the corner. Now, who besides me is old enough to know Dirty Dancing? Because yes. I know this reference dates me, but I don't care. There's nothing as good as Dirty Dancing. So if you haven't watched it, watch it. It is the best. I feel like organizations are putting baby in the corner. They're putting wellness in the corner and not really tapping into the true capabilities that you have. When I think about the education, the knowledge and skills that most wellness professionals have, you're probably not being tapped into the resources. All right. I'm glad I'm not the only one, Joan, that likes that movie. It's a classic. I did a podcast on this. It was a solo episode. I'm happy to connect it with you guys. But really what I'd love our role to change to is from a wellness coordinator into a well-being integrator. And so let me tell you kind of more of what that is at a high level. So this is one you may have some beef with me about. You don't have to have necessarily expertise in a specific health niche. So I'm a dietitian by training. I don't hold my I don't do any dietetics anymore, but you wouldn't have to be me to be in worksite wellness or a fitness person or anything, but you do need to get those people on your team. But an integrator really says, here's well-being. Here's what I think well-being, our model of well-being, right? For an organization, here's our model of well-being. Here is our existing structure in our organization. How does well-being fit into those existing structures? All right. So in other words, where are leaders already assembling? Where are employees already assembling? What are all the touch points? New hire orientation, onboarding. I mean, everything that goes with the employee touch points. How can you bring the wellness resources to them? How are you connecting it to the business? If what you're doing is not reflective of your business mission or vision or strategy, it's just much harder to connect and integrate. I've already said this, but think about where people are already existing, where they not only meet policies, procedures, even think about from a benefits perspective. Here are our benefits. What if we put a lens of well-being on our benefits? Does it fit? Do we have the right benefits here? Do we need to tweak any? Collaborate. Many of you are doing that already. And then the natural collaborative opportunities are, of course, leadership and development. I've already mentioned them. Organizational development. Any of your HR business partners are going to be crucial partners for you. Any kind of training. And sometimes training takes place in HR, but there's also some organizations that have training out in different departments. Benefits, I was going to leave that for last. The most common model is where there's benefits and then well-being reports into benefits. I don't love it. I think if you take well-being out, then there's other ways that you could kind of connect across HR or within the organization. But I have to say, Tracy, well-being and benefits are most closely linked. That's problematic for me for a few reasons, but as they say, it is what it is. So to me, we have to shift our role from, hey, I'm the wellness person within benefits doing some programs, to it's not an extra. It is actually within embedded in the fabric of our organization. Heather, I love that. So Heather's integrated into their talent management that you want your employees to be their best selves. That's wellness, right? It opens it up to all employees. Okay. And so even if you can't, so Tracy, you said you work in benefits, you can still work across the organization. So it doesn't have to be this. I just want to bring it up as a possibility. And I'll leave you with this quick story. I've been talking to a prospective client for literally 2 years. Like, we've talked, I've been helping them out with a few things. And I was so excited because they were really getting excited about this well-being thing before COVID hit. And they showed me their job description and it sounded wonderful. It sounded like too much. Let me be honest. I said, there's like 8 different skill sets in this job role. I don't know if you're going to find that person. But then we started talking and they said, oh yeah, well, we're going to put him 2 layers under me and we're going to pay him like really low wages. It's like, that is not what this role is. When people get hired in as wellness professionals, typically, I'd say most organizations put baby in the corner, and it's a very minor role to the potential that you all and wellness professionals can bring to an organization. So there's my rant. It kind of felt like a rant. Sorry, guys. I kind of feel passionate about that. So the 4 ways to redesign wellness are health, even after the pandemic is over, whatever that means. Connect and support leaders. So just making sure your leaders, like you're reaching out to leaders and going, here's what I've got. Do you need anything? Being inclusive, either using those questions, connect with your DE&I folks. Susan, yeah, most wellness committees are made up of volunteers, and that makes it a little bit tougher. But there are some things to consider there with potentially getting it more of a, I don't know if it's be considered an informal leadership role in your organization. Thanks, Tracy. I know. I think it hits us, and I'm curious if everyone's different, how long they've been in the field. I've been almost 20 years, and I get a lot of people who are feeling like at this cap in their career because, again, it's in the corner. Do your best to elevate your role. You can only do so much. I always want you to think about your frame of control. And when some of this feels like you're beating your head against the wall, go, hey, I can only do so much. You can only control yourself. But I do encourage you to ask a few questions, collaborate, and, push it a little bit, maybe. And if you're feeling like, I don't know how you're feeling. I'd love to hear how you're feeling. You may have been like, Jen, I know all this. Some of you may be overwhelmed. All I'm encouraging you to do is just take that first step. And so as we answer questions, I always want to say, what can you do with this? What is one action step you want to put into practice? If nothing else, connect with each other, because you have there's some amazing things going on in the chat that I think you guys would love you to connect. Feel free to put your action item into practice in the step. There's my information. There's me and my family, and there's our rig. And this is actually a year ago. So my kids are a little bit bigger. Thank God the dog's not any bigger. Sandra, good. Supporting middle managers. They need it. They need it desperately. So I am going to invite Elliot back on stage, and we're going to get to some questions you all have.
Thank you. That was great, and a lot of information. So one of the questions that came up from a few people, I'm just going to say now that I'll post this as soon as we get done, or we'll get the information out, was can we restate what agency has a mental health toolkit as a part of Mental Health Month? That the link that Sandra gave was Mind Share Partners, MINDSHARE partners.org. And we'll get that typed in as soon as we can. So
there's also Elliot, I'm going to put in here too. There's Mental Health America that has an amazing toolkit.
Great. Great.
Yeah, I put it in there, but I think it's putting it as ask.
And if anybody else has any, as we're talking, any of their favorite sites, please go ahead and put that into the chat as well. So one of the questions that came up, Jen, was sometimes team connection activities can feel cheesy and forced. What are your favorite team connection activities?
Oh, so true.
I'm going to answer that, but I'm going to say one more thing real quick.
Sure.
You will sometimes get pushback from leaders who say, I don't have time for all that crap. I just need to get to business, which is a problem in the first place. But first thing is you can always limit the time. You can say everyone gets a minute, everyone gets 30 seconds. So just make sure there's that there. 2 questions. I'm starting to get a little creative with my questions. The first question I ask is usually, what is one good thing that happened today? And so I sometimes do 3 good things. It's a practice of gratitude. So that usually sets people in a positive mood. And if it's first thing in the morning, it can just be one good thing that happened. There's one I used recently that was kind of fun, and it just depends on your group, right? I did a training last week, and I said, if you were a wrestler, what would be your entrance theme song be? I mean, that was one that was kind of fun. I would just say make it fun. It does not have to be
laborious. It doesn't have to be long. I would just get people to ask a simple question that's 30 seconds or less. Of course, I'm blanking on any other good ones, but those are the ones that I tend to, that's the one I just used to mix things up. But my fallback is the 3 good things. If you do Google, you can Google some questions, and there's some great ones. There's also something called 36 questions to bring you closer together. Some of them are not appropriate for a team, but some of them are really just cool questions. Like, if you could have dinner with someone alive or dead, who would it be? So there's those type of questions. You do have people, some considerations that are introverts, and they're not going to want to think on their feet. They need some time to analyze it. So it'd be easy on the introverts. But yes, I don't know if that answered it. If you want to reach out to me, I'm happy to send you some more. But those are the ones that come to mind. And let me know if that was helpful.
Perfect. Well, I'm sure we'll get some people in the chat room. How can we support people to be as kind to themselves as they would be to others in their situation?
Yes. This pandemic has hit a lot of people hard. I think one subset of the population that it's hit the hardest are high achievers. And I say hardest, that's not fair, because there's been so many other things. So let me scratch that, pretend like I never said it. We're going to strike it from the record. I'm finding that the people that are high achievers are really struggling because they have not lowered their expectations at all of themselves. So they are grappling with kind of being crappy in a few segments of their life. I don't know what you can say except for, hey, connect them with other people who are struggling, because sometimes it's just the connection they need. And maybe sharing with them like your own personal struggles. I mean, I'm not saying you need to go make it a therapy session, but just say, this stuff's hard. Hey, I'm on camera today. Thanks for allowing me to shower. I mean, it's just, and then just reminding them, like, you can be nice to yourself. Like, it doesn't have to be this hard, kind of making it easier on yourself. I think it's just making sure that you're lowering your mask, if you will. I'm not saying you carry a mask, but like making sure that they know you're real people too. And I think that can help go, okay. Sometimes it's just hearing that if you hear yourself speak aloud, like if they're talking to you, then sometimes that's just helpful in itself, because they can hear themselves go, oh, yikes, those are some high expectations.
Yeah, it's true. So let's see. It's a good question. Boy, it's one as an old time communicator, most companies have direct communications to the employees, even more true now with phones and everything. But what are your ideas on how to teach spouses and partners, how to reach spouses and partners to provide resources?
That's a continual struggle, I think, in the wellness world. And even when I was back in my many roles, we've always struggled with spouses and partners. And I think for every, the answer is that it just depends on the organization. It usually comes up in claims cost, because spouses end up being high claims, and usually it's the women who are more likely to get their husbands to do their preventive care. And so I don't have any great answers. Let me just be honest. I think mailers are something that we've tried in the past. You send mailers directly to spouses. It's that line of communication. I think that's an important piece to tackle, but I'd say that maybe just dealing with the population you have in front of you for now, and getting them first. Because if you get them first, then maybe you can pull their partner into it. But it can be as simple as, if you're running a challenge or a program that you're inviting spouses in, can spouses be part of it? I think that's a simple way to get them involved. Sometimes it comes with extra cost, but it could actually get more people involved.
Yeah. Yeah.
Okay.
True.
I probably butchered that answer, but there you go.
No, you did fine. You did fine. In the middle of a pandemic, health and wellness is so important. In 3 years from now, when COVID is hopefully mostly hindsight, how do we keep wellness as important as it is today?
Well, the thing that I think right now is, like, the work you're doing right now, continue it.
because you're building on it. All the connections and all the relationships that you make right now are going to carry you into 3 years.
Yeah.
So making them now, helping people understand what you bring to the table, your skills, what you can take on, forging those relationships matter. And if you're not making those now, you're going to have a hell of a time making that later, right? Leverage what you have. We have some momentum now in our field, and how can you really collaborate, make the relationships now? Because that can last 3 years into it.
I'm also going to add this, and I'm not a negative person. I am generally convinced that the glass is 3/4 full, not half full. But this is not the last pandemic that all of us are going to deal with. So one thing I'd say to the people who are on the call is I wouldn't anticipate putting COVID behind us, or we may put COVID-19 behind us. But I think what we really have to do, and I generally hate the term the new normal, but I think we have to recognize that we're going to deal with these kinds of infectious situations over and over again. Hopefully not more frequently, but at least over and over again. So I think whatever systems we build, whatever methodologies we perfect, they'll be important to us going forward. Another question just came in. What 1 or 2 well-being priorities would you focus in on if you had no budget to work with, but an open-minded organization?
Oh, that's fantastic. Because yes, that is a fantastic question, Cal. An open-minded organization is half the battle. Okay. If you have an open-minded organization, you're winning. I would say you can focus on leadership, just getting to know your leaders, what they struggle with, see what you can create. And then just focusing on mental health. There's a ton of free resources out there. I'd say those are the 2. But I would say that do something and then get some budget. Maybe if you do that, then you can get some budget. But start with that, and I think that that can be super helpful. But like I said, if you have an open-minded organization, that is winning.
And as somebody who deals with budgets all the time, I would go right to the source, whether it's your VP of HR or your CFO or your CEO, if you get lucky. I would go to them and say, what do you need me to demonstrate for you to give me a budget, for you to give me $5,000? Just get me started. Go ahead, Jen.
Yes. No, that's so it. You have to ask first, and you need to provide the value. You need to say, with this money, here's what we're going to do. We're going to train leaders to spot signs of mental health, issues, and then you're going to have more productivity. It's the value, and so they understand what the value is. But first, you have to ask.
And sort of staying on that theme, the other piece is that this is a great opportunity to engage with, and I'm going to say it specifically, those old white guys in the C-suite. So talk to them, find out what the struggles are at home, find out what the stress points are, find out what's happening with their kids in school, find out what are they planning on doing for summer to deal with the situation. If you ask them, it's like any interview situation. If you ask them a question, chances are they'll start to talk and they won't stop for a while. And then you can try and build something off of their own experience. So,
yeah. And Deborah makes a good point that health insurance, I've had people pay me through health insurance providers because there's wellness dollars.
Yeah.
Some that provide. So there,
what I've always said, there's always money if it's worth it. I talked to an organization that spent $1.2 million on marketing. Because they saw it as worth it, right? They saw it as they're going to increase their bottom line. So you just have to provide that value or show them that value.
All right. This is such a perfect last question. Someone wrote in and said, love the RV. How do you travel and work? Do you homeschool?
That is the hardest thing about RVing. And there's been a few times where my kids were acting a fool and I said, we're done. I can't do it anymore. My husband homeschools. And it's funny. We get him on his basics and then we try to get him out learning things in the areas we're in. So my daughter's only 4. She has 1 more year before kindergarten. And then my son is almost 8. And he's a tough cookie. So homeschool. Yeah. We homeschool. I work and everything kind of blends together. Pretty much like a lot of other people's lives during the pandemic. So yeah, it's fun though.
And where are you going? You were telling us before you're heading from Austin to Fort Worth and Dallas, and then where?
Yes, out west. We are going to go get to less humid air. I'm from Alabama, so in the dirty South with you all, and it is hot and humid. So we are getting, we're going to go out where there's less humidity out west.
And when we have this conference next year, will you have landed someplace, or do you know where you're going to land, or
We
what's the
don't.
plan?
Yeah, that's part of what we're trying to figure out is where is our home base? When are we going to where are we going to settle? We don't know.
All right. So
To be continued.
So for everybody, thank you so much, Jen. When the movie version, Nomadland 2, comes out, we will be thrilled to see your story and to hear about that. But this has been not only a ball, but it's been great. And please keep us informed about your adventure. That would be wonderful. So thank you on behalf of everybody on the line. Look at all the hands clapping. We appreciate that. And I'm going to ask Cassie to come back up on stage.
Yeah, thank you all.
That was fantastic. That was so thought-provoking. Thank you so much, Jen. I know everyone's bringing back some new ideas to their organizations on how to better integrate our well-being in these times that we're in today. Thank you so much. We now have a raffle drawing. So we have 3 prizes that we're giving away to put the cherry on top of our presentation today. And Elliot's going to help me out with that. Our first raffle drawing is a gift card to a local restaurant of your choice, sponsored by Aduro. So who is our winner, Elliot?
The lucky winner turned out to be Suzanne Weiland from Miller Electric Company.
Congratulations, Suzanne. Awesome. We have another. All right, another local restaurant gift card sponsored by Ramsey Smart Dollar. Who is our winner?
This winner is Michelle Rodriguez from City FM.
Woohoo! Congratulations. And finally, we have the Fresh Jack's Organic Spice gift set sponsored by Fresh Jack's Organic Spices. And I can say firsthand, these are delicious.
Oh, look, it's me. No, that's not nice. Adele Herring from the Duval County Public Schools.
Congratulations, Adele. Fantastic. All right, so I hope you all enjoyed the presentation today. We're going to return everyone back to the ballroom so you can continue with your conversations, with networking, and we will see you back tomorrow for our annual Healthiest Companies Award ceremony. And we're really excited that we added a panel discussion with 3 award winners, so you'll get to learn what some other local companies are doing with wellness and ask your questions to them directly. So make sure to tune in tomorrow, and we'll have the ballroom open for another 12 minutes. We'll see you then.
Thank you.